Good afternoon. This is Mark Adams of the Employers Association of the Northeast. We will be starting momentarily. In order to ensure that you can hear me correctly, just please, if you can acknowledge that in the question box used in the GoToWebinar dialog platform, I would appreciate it. Thank you. We will start momentarily. Thank you for acknowledging that request for me. We will be starting momentarily. Good afternoon. On behalf of the Employers Association of the Northeast, my name is Mark Adams, Director of HR Services, and I would like to welcome you to today's special webinar on the coronavirus and the workplace. The coronavirus has created disruptions locally, regionally, and nationally and globally. It has affected society in general, and in the process has cascaded down to affecting employers as far as how they operate. As you can imagine, we've been fielding numerous hotline calls from members on the subject and have been actively monitoring the situation. Well, we hope today's webinar will provide you with a landscape of the situation, both in terms of issues that you need to be addressed, what options that may be available to you, and the pitfalls to avoid. I do want to point out that this webinar is providing you with this picture based on what we know at this point in time. So we will start with a quick overview of the coronavirus, what it is, the current data, and the scope before shifting to what business initiatives to consider and their limits. Make no mistake, this is a very fluid situation on an illness that healthcare experts are still trying to figure out. Responsive action, statistics, and scope are changing daily. As always, we welcome your questions. However, in light of the size of our audience, I would appreciate it if you would defer those questions till the end of today's webinar, where we will try to take them in turn as time and opportunity allows. Additionally, we will be also providing you a handout of these slides at the end of the webinar. We will be emailing them to each of the attendees on today's line. So I do have colleagues who will be monitoring these questions. So again, we can respond as time allows. So first, what is the coronavirus? It is actually somewhat of a misnomer. In reality, according to the Centers for Disease Control, coronaviruses actually refer to a family of respiratory illnesses that are fairly common to people and animals, though may vary in severity. The moniker COVID-19 was given to represent the current strain that is known to have originated in Wuhan, China. COVID-19 is actually the illness that originates from an underlying SARS virus called SARS-CoV-2. So when we talk about COVID-19, we are actually talking about the illness derived from the virus, not the actual virus itself. As some of you may know, the transmission of COVID-19 is very similar to the flu, as well as its symptoms. Primarily, it is transmitted through droplets or fluids, typically associated with coughing or sneezing, as well as being in close proximity, typically within 6 feet of someone who is infected and is coughing or sneezing. However, coming into physical contact through other means, such as contacting surfaces that contain such liquid droplets, and then touching one's face in a manner that may similarly cause the inhalation of the virus, could be another example. Because the symptoms are reminiscent of that which individuals endure when they encounter a bad case of the flu, it is important to understand that the symptoms are not automatically proof positive that one has the virus and the illness. Rather, a definitive case of having the virus can only be established through testing. While this sounds simple enough, access to testing kits is being regulated by state and local public health officials. While the exact procedures may vary depending upon your state and jurisdiction, generally speaking, testing is being limited to people who have shown symptoms of having the virus and in addition are known to have traveled to certain high-risk countries or communities or have otherwise come into close contact with someone who is known to be carrying the virus. So these are the statistics as of today. Right now, there are about a little over 137,000 cases reported worldwide. While over 53% have recovered, 3.7% of the total cases worldwide have resulted in fatalities. The vast majority of the total cases, however, about 59% of them, have transpired in China. By contrast, currently, only about 1.3% of the worldwide cases, just a little under 1,800 cases with 40 fatalities, have occurred in the United States. While at first blush, that small percentage in the United States may make you wonder, is this really a problem? It is important to understand that these numbers are changing daily and fairly rapidly. The current trends indicate the number of active cases have declined in China, while the number of active cases continue to climb in Europe, the United States, and parts of the Middle East. The question that many have is, what is that curve? How long of a period of time are we looking at before things subside in the United States? Is it 6 weeks? Is it 8 weeks? Is it 10 weeks? No one knows for certain because there remains some uncertainty as to the exact date of when that curve begins. As there were initial news reports dating back to the end of December 2019, though, there is a report that actually came out in today's edition of the South China Morning News Post that indicates that the first confirmed case of COVID-19 can now be traced back to November 17th of 2019 based on their examination of China's data. So I put this slide up not to trivialize COVID-19. That is not my purpose or intent. However, I will point out, of course, that there are two key differences between the statistics associated with COVID-19 that we put up in the previous slide and this data relative to the flu. One, of course, is that currently COVID-19 does not have an actual vaccine, while the flu has one that at times is effective depending upon the strain of the flu. Second is that the mortality rate of COVID-19 is indeed higher than the flu, again at about 3.6% worldwide, as opposed to less than 1% of flu cases. Though that latter point can be alarming to some, it too needs to be looked at closer, as there are sizable differences by age group. In examining the initial China cases, for example, the COVID-19 mortality rate for people who were under the age of 50 was actually only between 0.2 and 0.4%. While for people who were over the age of 70, it was 8%, and over the age of 80 years, it rose up to over 14%. The point I am trying to make with all of this data is that in both cases, the groups at greatest risk are older populations or those who have issues with their immune systems due to other conditions that they may have. For others, such as younger and healthier groups, the outcomes will manifest themselves in other manners that are more akin to what many of us encounter when it comes to a bad case of the flu. Again, symptoms being cough, fever, and shortness of breath. For companies then wondering, how will it affect my workforce if my employees catch it? It will depend on your workforce's makeup. In examining the case data from China, mild cases, which according to their data accounted for roughly 80% of those cases, resulted in a recovery time upwards to 2 weeks. Whereas for severe cases where recovery occurred, the duration of recovery took anywhere from 3 to 6 weeks on average. So what do you do? Where do you begin? What are your options? It is a cluster of questions which may not have the exact answers for everyone. However, at its core, you need to examine and balance your business needs with your responsibilities to maintain a safe workplace. From a business needs standpoint, you need to evaluate your demand and obligations to your customers for your goods and services and any contracts associated with them. What level of flexibility do you have on fulfilling those orders and requests and needs? For example, are there clauses in your contract, sometimes referred to as force majeure clauses, that might provide some relief from your commitments or contractual penalties? If not, there may be a need to engage more in renegotiating those terms to provide some flexibility for you and your organization. What contingency plans do you have in place so that you can operate and maintain your operations? Some plans may have been built around how you respond to certain other situations, such as natural disasters like storms, earthquakes, fire, power outages, and the like. Do they address and account for pandemic circumstances and the potential for drop-off in your staff or workforce? How might you readjust your staffing and delivery models? Might you seek to augment your staff with temporary or per diem staff? Engage in rotations of staff so people work in your workplace versus remotely, so that if there are situations when it comes to exposure, you can minimize exposure with your workforce as a whole? Are you engaging in partnerships with other organizations to outsource some aspects of your business? How might roles be restructured to streamline processes? From a non-staff standpoint, do you have backup or redundancies when it comes to your supply chains? In the event that one may not be able to fulfill your request, you have another that's a backup to meet your obligations that you have. Are your networks or technological infrastructures robust enough to allow for additional staff to work remotely if needed? And finally, there are emergency preparedness plans. What if you do indeed have an exposure in your workplace? How are you going to respond? How are you going to communicate that to your employees? How do you change what you do in the short term and in the long term? And how do you engage with your clients and customers in response to those situations? These are all issues and questions that you should be thinking of if you have not already done so before moving on to some of your next responsive measures. Because certainly when it comes for businesses, there are several layers to that type of planning. However, from a human resource point of view, it is really important to be that partner to understand and identify those plans and contingencies that have been put into place by senior leadership, so that communication, policy, and other HR initiatives can be tailored to effectively align with those plans. While there needs to be a level set of expectations and responsibilities moving forward in the wake of such disruption and change, It is just as important to engage in a manner that provides a clear understanding that there is a plan in place to respond to the situation. Many HR professionals are getting a leg up on the communication curve. In a coronavirus survey that we conducted this week, in fact, 55% of respondents had indicated that they are distributing CDC information on the virus to their employees regularly to start educating them. So, what type of options are out there? There are several when it comes to policy flexibility. Some may apply to some businesses more than others. Certainly, when it comes to that flexibility and adjustment, there might be several that come into play. For example, might you relax your attendance expectations as to what may constitute an occurrence? Might you put more PTO on the table either at the onset or in situations where someone has exhausted their time but later may calm down with the virus and is quarantined? Being more open-minded to working from home, either because the job in reality can be done completely on a remote basis, but you may never have given that much thought before, or you may need to scale back the job somewhat so it can be operated in a more limited fashion. The common theme behind these initiatives is to foster an environment where employees do not feel compelled to work when they may be sick or at risk of getting others sick. Out of the 221 respondents that did take part in that survey I was mentioning earlier, 2/3 of them strongly encourage employees who feel sick to stay home. On the subject of providing additional sick days, only 2.7% indicated at this point in time that they were considering that option. Separately is the idea of being flexible with personal leaves of absences as well, especially given the potential to respond to employees' needs for time off to attend to family matters, such as if school systems close down as precautionary measures themselves, as there may be employees who need to have that time away to attend to their kids. How are you planning to respond to that? Will you? You should take note that those type of leaves, as they stand, wouldn't be covered under other statutory leaves, such as the Family and Medical Leave Act and most state parental leave laws. Finally, when it comes to travel restrictions may be a consideration. Instead of traveling to visit customers, maybe Skype and virtual meeting platforms where information can be shared, as well as using such technology as web-based folders such as Google Drive or SharePoint, can allow for effective engagement. According to our survey, 19.2% of respondents indicated that they were putting restrictions on business travel for any types, whereas 10.5% indicated that they were only putting restrictions for international travel. And yet downward to 8.3% were imposing restrictions when it came to travel or visits for voluntary conferences or meetings. So a much smaller number than some of the other travel restrictions out there. A fundamental component when it comes to being proactive in mitigating risk of exposure in the workplace, regardless of industry, of course, is enhanced safety and hygiene. Some companies have already implemented some of these measures just to combat with the seasonal flu, whereas others may not. To some, it may seem like common sense, like washing hands and disposal of tissues after use, while others may be a matter of doing these things in a more sustained and deliberate manner, like wiping down workstations and other high-touch areas like countertops and doorknobs. Of note, if you are going to engage in these measures, solutions to use for these purposes should be left to diluted bleach solutions, or if you're going to use alcohol-based solutions, they should be at least 70% alcohol as a base. So it's important to check your labeling to make sure that the solution meets those type of minimum thresholds. The key to these initiatives is management commitment, practicing it and preaching it to employees. Hold employees accountable if they do not do their share as well to support these safety practices. Are they going to be responsible for their own workstations? Or are you going to be taking that all on your own? Is it going to be your supervisors that are going to be the ones doing it? If they don't dispose of items properly or cover their cough properly, for instance, will your supervisor step up and remind or coach them? Having your employees see your supervisors and managers demonstrate their support of these initiatives and their commitment can go a long way towards fostering an engagement and a greater confidence that you mean what you say. For some industries, especially manufacturers, there is an understanding to provide personal protective equipment, otherwise known as PPE, to employees to reduce exposure to hazards. It is a byproduct of such standards such as Bloodborne Pathogens Act and the OSHA Respiratory Protection Standard. To some, the question is, do we have to provide face masks to our employees? The general answer is no. According to the existing guidance, face masks are not recommended for general use by individuals who are merely asymptomatic as a preventative measure. And for some who are buying them off the shelves of big box and retail stores, many of those may not necessarily be effective even if there was an exposure. The National Institute of Occupational Safety and Health, NIOSH for short, has certain classifications for face masks which, according to CDC, would be effective should an exposure occur. However, when it comes to means of transmission and probability, it is currently recommended that their use be tied to those who are either infected themselves, rather so that they don't spread it to those who are not. And then in other cases, it's recommended, of course, for people who are healthcare workers and those who are more vulnerable to respiratory or immune conditions. We have had calls from companies asking, when can we keep employees out of the workplace? Well, it depends. This issue has typically manifested itself when encountering challenges and fears from employees after another coworker has traveled abroad. While not all travel is viewed the same way, some destinations have a higher community spread of the virus than others. As a result, the CDC has set forth standards and recommendations that employees self-quarantine for 14 days if they have traveled to or from a level 3 country only. The original countries classified as level 3 countries include China, Iran, Italy, and South Korea. However, on March 11th, President Trump signed a proclamation limiting access from the United States to other countries and from individuals traveling from those countries. I have listed these countries on the slide here and furnished a link for future reference. There is approximately 26 countries in total. In response to this proclamation, the Centers for Disease Control has subsequently updated its page to characterize all these countries as level 3 countries as well. In doing so, the CDC is recommending travelers avoid all non-essential travel to these countries, especially older adults and people of any age with serious chronic medical conditions. There are exceptions to this ban, most notably U.S. citizens, lawful permanent residents, including their spouses and siblings under the age of 21. There are several more narrowly defined exceptions, for example, members of the U.S. Armed Forces and their families, as well as numbers of different non-immigrant types coming in under various visas for various government and NATO business, UN officials, individuals supporting law enforcement or homeland security, and those are spelled out in more details in the proclamation. For private employers, the exception for citizens and lawful permanent residents, and when you think of that, think of like green card holders, would be the ones of interest to some on today's webinar. So while those might be exempt and might therefore have access to the United States because the travel ban wouldn't apply, okay, it is still important to understand that since they are coming from a level 3 country, self-quarantine protocols would still apply to them as well. So when it comes to travel, it is recommended that employers continue to monitor CDC and other resources for any changes as to how countries may be characterized so that companies do not overstep their bounds when it comes to keeping employees out of the workplace. So, in summary, employees can be kept out of the workplace if they are coming from a level 3 country, whether they are symptomatic or not. But also, of course, it is recommended by CDC and State Department of Public Health. Those can also be examples as well where they can be kept out. So if there has been a determination that someone has manifested symptoms, for instance, and they have been determined to have been exposed to someone carrying the virus, or they have found out and have tested positive, then that would justify keeping them away as well. Given the impact that a quarantine measure may have on an affected employee, both from an economic and an employee relations standpoint, and for reasons that I will touch upon next, it is important to consider these measures carefully. And the reason why I underscore knowing your boundaries here is the Americans with Disabilities Act. The ADA not only protects employees who are actually disabled from being discriminated against, but it also extends and protects to those who are perceived as or is regarded as disabled as well. Thus, if you were going to keep them out of work, for instance, above and beyond that which has been recommended by the CDC or public health officials, and they are asymptomatic as well, then there is a risk that you are taking on some risk, and that risk could be in the form of getting sued. Under the ADA generally, ADA medical inquiries of current employees are only permissible of current employees if they are job related and consistent with business necessity. So for an asymptomatic employee who is otherwise fit and willing to do their job, making such inquiries would be impermissible. Rather, if you're faced with that situation of employees who are asymptomatic, it's not a question of probing their medical history or medical conditions. Rather, you want to foster an environment whereby employees are encouraged or allowed to feel comfortable keeping you abreast of their own circumstances of a potential exposure so that you can react and respond accordingly. However, here too is an example of topics changing rapidly. On March 11th, the World Health Organization deemed COVID-19 as a pandemic. However, the CDC has yet to do so at the present time. It appears only a matter of time when that will happen as well. Now, you may ask, well, what is the significance of that change in status to a pandemic? Well, when you have a situation change to a pandemic, it does change the rules of the game somewhat. Under the Equal Employment Opportunity Commission's guidance, when there is a pandemic, an employer is permitted to make medical inquiries of employees when the employee is therefore considered to be posed a direct threat to the workplace based upon objective factual information. So instead of being reactive, an employer could be proactive in making inquiries and even medical examinations, such as taking an employee's temperature, for instance. However, depending upon the facts and circumstances of the situation. It is important to emphasize simply the existence of the pandemic alone is not enough to make medical inquiries and examinations of employees. There also needs to be objective factual information as well. So, a specific example in the guidance contrasts seasonal flu with the pandemic. If pandemic influenza symptoms become more severe than the seasonal flu, or if pandemic influenza becomes widespread in the community as assessed by state or local health authorities or the CDC, then it could be that an employer could measure an employee's body temperature and make a medical inquiry. But again, it's a question of context. So we're talking about COVID-19 here. The question then becomes, what is the level of community spread and exposure? And based upon the guidance by state or public officials, does that give you the green light to make those inquiries? It is something that we're not there as of yet. Again, it then relegates back to you looking at the situation in your workforce based on the objective information that you've been confronted with. So if the facts, for instance, deem by contrast that there has been a potential exposure based on someone bringing it to your attention, that then might allow you to engage in more proactive means of gauging the circumstance. So we have covered a lot of ground today, and I did want to leave a fair amount of time on today's webinar so we can answer your questions, because I know we have many people asking a lot of questions regarding this topic all the time. So if I had to summarize what I should do, one of the things sometimes we do at the A&E when it comes to trainings is put together little acronyms or terminology that may allow people to kind of remember or summarize what they should be accounting for. And in thinking about this here for today's webinar, I came up with the word PEAR. And you may say, well, what is that all about? Well, when I think of the word, the first thing that you want to do, you want to develop and more importantly, promote your initiatives. What plans, both HR related and business related, have you developed and put into place? And that so that you really can portray yourself as having that safety front and center in mind with your employees. So what initiatives have you developed and promoted? E is for education. You want to educate your employees, both on any knowledge that they need to understand in participating in those plans effectively, whether it may be enhanced safety, hygiene initiatives that you've been working on, or whether or not you are changing how they go about doing their job, what their role and approach should be. And also in feeling comfortable coming forward should they have symptoms or in need of guidance on next steps. Education could span on all of those levels. Then, of course, there's A. You want to assure your employees. This is a rapidly developing situation. A one-off communication is probably going to lose its effectiveness over time. Assure them that this is a priority and that you will be keeping them abreast as changes unfold and new guidance comes out. And B, R is going to be that you want to respond to those questions. In doing so, your answers and actions should be based on facts, not speculations. Communicate that, respond to those questions based on if it's, for instance, general questions about the scope of COVID and the current examples of what they can do to protect themselves. Answer those questions based on facts and knowledge, not based on stereotypes, rumors, or unsubstantiated information. So again, you want to promote your initiatives to your employees. You want to educate them on their roles. You want to assure employees that you're continuing to monitor the situation and that you are always there to respond to their questions as developments unfold. But then there's what are the things you want to avoid? And, when it comes to that, I've also come up with a word there as well. So when it comes to things that you and your managers need to avoid to ensure that your employees are not putting you or themselves at risk, think of the word SAD for what I call the don'ts of what you don't want to do. Certainly you don't want to stereotype employees from certain parts of the world who doing so by your managers, or allowing employees to stereotype employees just because they come from a certain part of the world, rather, whether it's China, the South Pacific, Asian Rim, that could potentially lead to allegations of national origin discrimination claims, for instance. A for alienation. You don't want to have your employees alienating someone because they have traveled, or maybe they have been cleared to resume their duties and are trying to come back into the workplace, or because they're just simply wearing a mask, which could be the case for elective purposes, or because they may have an unrelated serious health condition that puts them at risk, or they have otherwise been recommended by their doctor to use a mask. Employees alienating a coworker just because they've traveled abroad and have come back, or again, alienating someone who's been fit to resume their duties after, for instance, a quarantine, or picking on someone just because they're wearing a face mask, again, can all be situations, that can really have a serious employee relations effect, of course, to the employee, and depending on the facts, could even allow that employee to foster some sort of a perceived ADA charge, as the case might be. And finally, D, you don't want to divulge sensitive, confidential, or medical information of an employee to other coworkers who do not have a need to know. Certainly, if an exposure has taken place in the workplace due to an employee bringing it to your attention, it may be necessary to involve selected senior managers for planning and responsive purposes. It may be necessary to contact CDC if they have not otherwise been made aware of the situation. But when it comes to others, divulging identities and their medical information specifically to them can be a problem due to ADA and other laws, both federal and state. Rather, making employees generally aware that an exposure has taken place in the workplace and providing them recommendations and guidance as far as their next steps, such as seeking medical attention, of course, is advised. So we have a number of resources that we have provided members. We have, for instance, on our website, a coronavirus toolkit for our members, but we also have some additional guidance for those of you who might be on the webinar today and who are not members of EANE. That could also be found on our website as well for your convenience and education and benefit. Separate from that, there are some additional links that you might want to also consider as well. The CDC has a page that is being continually updated when it comes to their recommendation and guidance. And again, like I said before, this is a fluid situation. Guidance and perspective and initiatives are changing over time. So it is something you're going to want to continue to keep abreast of long after this webinar is over, as long as this remains a pandemic or other public health situation. The Department of Labor has likewise come out with perspective on how the Fair Labor Standards Act applies as well. Certainly, we have gotten calls from companies when it comes to, well, I've got an hourly employee who, for instance, has to be out and they have no paid time off available. Do I have to pay them? And the answer to that question is no. When we're talking about non-exempt hourly employees, you're only duty bound to pay for the hours that they've in fact work. Salaried exempt people, on the other hand, if they're out for the whole week, maybe there's not an obligation to pay the salary. However, if they've worked a part of the week as a salaried individual and then they miss some time and you're not allowing them to work, but they don't have paid time, you may still be on the hook with paying their salary under those circumstances. So the guidance gets into that and other components as well. EEOC has got guidance on pandemics and ADA. I touched upon some of that today, and again, they get into it in much deeper detail. Johns Hopkins University is the source that I've referred. It's probably the one site that, in terms of getting up to the minute case data of confirmed cases, active cases, that is available in real time. That often is an excellent website to go to check those things out. And the Occupational Safety and Health Administration has likewise come out with additional information as well on the subject. So again, we would encourage you to kind of bookmark these links, revisit them over time. And again, also, if you are a member, don't forget our toolkit as well. With that, I know we have several questions for people who have taken part on today's webinar. I've got John Henderson from our team here who has been monitoring these questions, and I'm going to open it up to John to put some of these questions on the table for consideration and response. So, John, take it away.
Thanks, Mark. And just FYI, I know that some of the people on the call or on the webinar have mentioned that President Trump is planning to do I don't know if it's a briefing or he's going to speak at 3 p.m. and it said that he's going to declare a national emergency. And with that, Mark, do you have any idea what that could possibly mean for employers?
Well, certainly if it's a national emergency, it might open up, again, additional inroads for employers to be a little more probative. Until we know exactly the detail of what that stands for, I would really suggest people monitor that information, as those directives and their detail might then cascade down to how states act moving forward, which then could open up channels for companies to do additional things proactively. But until that really comes out, it would be speculative at best on my part to really indicate how it would change the steps we've talked about this afternoon to this point.
And while we've been on the webinar as well, Governor Baker of Massachusetts has banned gatherings of 250 or more immediately, but this does not apply to places of transit, grocery stores, or restaurants.
And we do have some people that are on the line from Connecticut and Rhode Island. I mean, when you get into these type of bans and initiatives, it is a state-by-state determination as to how they want to handle that. So again, as this example indicates, it is a very fluid situation on that. Just because Mass has banned gatherings over 250, that doesn't mean other states are going to follow suit, or maybe they might follow suit to different thresholds. So again, you might want to check your state's web pages as those things unfold. Similarly, states are now starting to catch up with loosening up their unemployment standards when it comes to eliminating any waiting periods to file for unemployment benefits if people are not able to work for given reasons, or they might otherwise have lost their job or furloughed due to the circumstance. Those are still unfolding as well.
So we have quite a number of manufacturers who are on the webinar, and they can't have people work remotely because they have to be there to do their job in order to make their product. Temps are not an option, they've stated. How do they deal with absenteeism?
Well, it's really going to become a question of, are they going to, well, first of all, when it comes to, it's going to also depend on why exactly they are out. So since the question didn't clarify that, if, for instance, it's simply a self-quarantine measure and they are asymptomatic, well, the employer's got some flexibility. While I wouldn't condone or recommend they count those things as occurrences, I think because you certainly don't want to have people coming back prematurely and running the risk of creating exposures for others down the road. That might exacerbate your attendance issues. than help you. It might be a situation where you might want to make those exceptions to your attendance policy. But I think the issue is, given the limitations you might have in terms of working remotely or bringing in temps and per diems, to your question, it might very well be that you examine, maybe you focus on more of how maybe we can redesign our processes to make things operate a more lean fashion. I know a lot of manufacturing companies have adopted lean management principles, and that might be something you try to implement in a more scalable fashion to meet those needs. And the other side of it might be maybe engaging in your customers to loosen up some of the production demands that can be more manageable for you with a smaller staff that you might have.
So another question about independent contractors. So if an organization uses independent contractors, what can we require of them?
Well, this is a very interesting question. Certainly as a matter of contract, you could certainly engage your independent contractors as far as expectations of what their responsibilities are in meeting the services that they're required to provide you. Now, it might be that the contracts do not affirmatively establish specific actions that they have to provide you with to demonstrate, for instance, that they are asymptomatic or something like that. And in that respect, you might be somewhat limited in what you can do, because if you are imposing additional barriers outside of the scope of a specific contract that you have with the independent contractors, then you could be setting up barriers that could create breach of contracts with those individuals. I think the prudent course of action with those people, given that there's probably not details in those arrangements that address the situation, is really having an active dialogue with those individuals to really see if they are going to be positioned to still be able to deliver on the responsibilities that they have of you, moving forward in the short term and long term. So again, to some degree, that's going to depend upon the type of person we're dealing with. If it's a contract with just a business and they're furnishing staff, that's one thing, versus just an individual where it might be not as formal and there might be more flexibility for engagement with them.
So the next question is about partial temporary layoffs. What is the process for partial temporary layoffs, and what kind of unemployment insurance would be available if people just simply have a reduction in the number of hours?
Well, I will say that when it comes to unemployment, each state's a little bit different when it comes to unemployment benefits. But in most states, when people's hours are reduced to some significant way, it might be 20%, it might be more, that could be a situation where it's enough of a material change in their working conditions such that they could be available for partial unemployment. That is something that in most states would have been there, even in circumstances unrelated to this type of situation. Some states actually have work share and other shared work arrangements where if a company is systematically reducing the size of their workforce to some degree or working hours in a department or across the company, there might be other monies available that can be provided by the state to offset that. Again, you're going to have to check with your state on those type of additional programs. And then finally is, like I mentioned, some states are still trying to expand things even on a broader basis right now, above and beyond even those considerations.
So with hand sanitizer being in short supply, we have a question about, if I don't or can't provide hand sanitizer, am I in violation of OSHA?
This is a good question. Well, they're all good questions. One of the things, as many companies know, but for some of you who may not be as in tune with the OSHA standards, we have this thing called the General Duty Clause, and that is if in fact there isn't a defined safety standard that regulates a subject, if the employer was acting in an unsafe manner that caused someone to get hurt in the workplace,
a company in theory could be cited for a violation under that clause. So it's very flexible, it's very open. I will say that at this point in time, I really question whether OSHA is going to go down the path of citing companies for that type of situation under the general duty clause for a couple of reasons. Number one, even if someone was stricken with an exposure, it would still be a question of fact as to whether or not that arose in the workplace. So that would be one big challenge to really show and demonstrate whether or not your workplace had the virus in its workplace. That would be number one. And I think number two, because of that challenge and because of a lot of the information still unfolding, I think it's going to be very hard for OSHA to start holding accountable companies to things that are still in flux when it comes to, definitive outcomes of what it takes to maintain a true safe workplace in its entirety. Everything we've talked about today is still evolving. And, what we're talking about doesn't provide an absolute guarantee that someone still couldn't contract it through other means in the workplace. So for a variety of reasons, I question whether or not OSHA is going to be out there citing companies left and right when it comes to general duty clause situations. Now, having stated that, I think the one thing that I could see be a bigger issue isn't that question that was posed, would be really if a company was on actual notice that employees actually had the virus and were fostering, facilitating, encouraging, coercing people to work in the workplace contrary to healthcare guidance about staying away and quarantining. And as a result of that, it could be established that people were contracting it. I think that's probably what it would take for OSHA to really get involved. So I think you certainly want to take measures to try to seek that those type of cleaning agents out. Like I said, there are different ways of cleaning workstations too. It might mean looking at other areas, looking online and so forth. So I'm not saying don't engage in using those just because of OSHA maybe not getting as proactively involved as some might think. But again, at this point, I think it's going to really require some more active unsafe practices to really create some of those OSHA issues.
So while this question is about travel and it's specific to a company, I think it can apply to others. They have a staff member traveling to the UK on a personal trip. He's due back on March 30th. Given that the CDC has not deemed this as pandemic yet, can I ask that he self-quarantine? And also, if I do I have to pay him if he has no PTO left?
Okay, well, let's take this in turn. There are two parts to that question. To the point, yes, Britain is not one of the earmarked companies under the European ban and is not a level 3 country. And with respect to that, that does mean that you really don't have a justification in accordance with prevailing healthcare guidance to engage in a unilateral self-quarantine of that individual. I would say that would carry some risks to you under the Americans with Disabilities Act on the basis of potential perception of disability claim should the person want to bring such action. Now, if that's still a path you want to take, then one of the things I think you want to really think about is eliminating any economic or other harm that the individual might have that would give them the incentive to want to pursue that claim. Many companies, for instance, when it comes to self-quarantining, even if it's a borderline call, are making the person economically whole to eliminate the economic incentive that might come with some risk of people who might have claims coming forward. Okay? So now this goes then to the second part of the question. If someone is in a self-quarantine, do I have to pay them? And again, when it comes to non-exempt people, the answer to that question is no. When it comes to salaried exempt people, the answer to that question is no, if in fact they are not working any part of the week at all. So again, if they're working a part of the week before the self-quarantine takes effect, or if during the self-quarantine, maybe they are doing some work for your benefit, that would create an obligation to compensate. So I would be very careful on a unilateral self-quarantine there. Again, because of the risks, it might be worthwhile to work out some other measures where maybe they're working remotely and you're compensating them so you can kind of strike that balance of getting some productivity out of them while trying to foster some safety as well, notwithstanding the European travel ban that doesn't apply in that case.
Okay, so I'm going to combine a couple questions here. One, is there an agency or would we be notified as an employer if one of our employees was exposed and was told to self-quarantine? And also, can you talk a little bit about, again, if an employee does test positive, don't I need to tell others in the workplace?
Okay. Taking those in reverse order. Number one, if someone has tested positive in the workplace, there isn't an obligation to disclose their identity to others, and again, doing so might be at high risk. What you do need to do, however, is disclose the fact that you have determined that an exposure has taken place and that it's your belief that that person seeking to find out who it is someone that very well could have been privy to such an exposure, and that you're recommending that they seek guidance from their own healthcare professionals as a result. As far as whether CDC is going to alert a company or individuals directly, that very well might be the case where CDC will do that based on CDC's engagement with those parties involved. They have a greater wherewithal to share specifics on that more than you do as an employer.
So what about if we have an employee going on vacation? Are we allowed to ask them if they're traveling to a high-risk geographic area?
The answer to that question is yes. You're not getting into engaging in probative conversations about their medical condition. It might be a good idea to do that regardless, just so that those people understand whether or not they might be facing additional restrictions on their return. You certainly don't want employees unknowingly traveling to areas where they are in for a rude awakening trying to get back into the United States, or might be facing quarantine barriers that legitimately can be provided by you, that might put them in a position of being out of work for a couple of weeks and maybe create some economic challenges for them. So certainly it might be worthwhile to engage in a conversation on that with those individuals.
And we've had a couple people ask about the slide presentation. We will send that out, the slide deck, to everybody that's attending this webinar. And if we don't get to all of these questions today, we will take the questions and answer those and send those out beginning of next week. Let's see. Can you review again at what point we can request a medical clearance for an employee to return to work?
Okay. It depends on whether they're symptomatic or asymptomatic. It depends on whether or not they've, separately, it could also be depending on whether there's been an exposure or not. If there's been a situation where they're symptomatic or asymptomatic, okay, if there is a situation where there's been an exposure or they have shown symptoms, return to work documentation is certainly okay. In both cases, there is a question of whether they're fit to work. It's based on objective information. That type of fitness for duty would be okay. If, on the other hand, it's simply a asymptomatic situation where they're in a quarantine, and after the 14-day quarantine, they're still asymptomatic, I would question and really advise and raise a concern about trying to make them jump through an additional medical hoop of getting fitness for duty documentation. Again, on the basis that you're perceiving them as disabled when they are not. And the question that I didn't cover in the webinar earlier is, you may say, well, why is 14 days the magic number behind all these quarantines? The prevailing medical documentation or the prevailing medical assessments of things are that if there is going to be a showing of signs of symptoms, a lot of times signs or symptoms show within 5 to 6 days of contact of such exposure, upwards to 14 days. So if they really clear that threshold, the idea that they really are in possession of the virus really is not been shown medically to be the case. Thus, the word of caution of trying to get fitness for duties of asymptomatic people who remain asymptomatic after a quarantine period.
So with the economic impact this is having, can I rescind a job offer that I've already extended because I'm concerned about whether we can really pay the person and maintain the work that we have?
If the answer, I would say yes, provided that the additional detail is not based out of concerns that the person you extended the offer to might be in any way, shape, or form of being perceived to be someone that might be carrying the virus or perceived as such. If you're saying, we're hiring a bunch of people, we have no qualms or concerns that they are a safety risk, it's just an economic conclusion that we can't really take people on anymore and we are freezing budgets, yes, that's perfectly okay.
So if a non-exempt employee works at home with remote access and tells us they are sick, but they still want to work, does this violate the mass sick leave law or expose us to any risk if we let them work while they are sick?
The answer to that question would be it's not going to violate the mass sick leave law if they want to work and you set up an arrangement to allow them to work. What would violate the mass sick leave law is if you tried to compel them to work and they didn't want to work because they were sick and they had the time available in accordance with the sick leave law to be able to stay out sick as well.
We're at 1:30. We're going to continue on answering some questions. So can we do temporary layoffs if we decide to close temporarily and promise to hire them back?
That's an option. Again, I would just be careful as to how hard and fast you guarantee bringing them back, because you might be creating obligations that if you don't deliver on could be problematic on that basis. But certainly temporary layoffs and bringing them back to work, or even not laying them off, doing short-term furloughs are options for consideration.
So if we discovered somebody at the plant has contracted the disease, I assume that the CDC or state, the Massachusetts Public Health Division, I assume we contact the CDC or the Mass Public Health System. Are we then required to shut down or quarantine our workforce or to require testing once kits are available?
I think, A, yes, you should be contacting CDC if you are aware of an exposure in the workplace. B, as far as the scope and scale of responsive action, That's going to really depend on the level of exposure in the premises, and certainly CDC and public health officials would be the ones to provide suggestions on those next steps based on the level of exposure.
Can an employer require an employee who travels, I assume abroad is what they mean, but who travels to be quarantined for 14 days?
It's going to depend upon where they're traveling abroad to. If it's a level 3 country, be they the original countries like China, Italy, South Korea, and so forth, or the European ones that have been noted as a level 3 more recently, the answer is yes, you can self-quarantine in accordance with the guidance that's been put out for 14 days. If the travel abroad is elsewhere beyond that, the answer to that question would be no.
Even if it's not a class 3 country, if an employee is traveling to Aruba, can we ask them to report to work for to stay at home for 14 days after?
Unless they've been otherwise exposed to somebody that and you're aware of that, or otherwise they're showing symptoms, merely going to Aruba would not trigger an automatic requirement for self-quarantine, and that would be problematic.
This one is from a Massachusetts company. Can we cover employees' health insurance portion while they are laid off, or will they have to take the state's insurance that is offered through Mass?
Certainly, if they're on a layoff, that could be a reduction of hours depending on the terms of the health plan that could trigger COBRA. And while COBRA allows employees to be on the hook for paying their premiums, should they elect COBRA, a company can subsidize and pay parts of those premiums at its discretion. Whether or not they're eligible for a separate health insurance through the state's a separate question that they would have to engage the state on, depending on the state that they're in.
This is an interesting one. So we have a sales employee that's returning from a business trip in Las Vegas, and other employees are voicing concern, and we're wondering if they shouldn't have that employee self-quarantine before coming back to the office.
Well, certainly that creates a couple of challenges. One is whether or not, in and of itself, going to something as populous as Las Vegas would, in and of itself, provide a reasonable likelihood of being exposed in an area where there's, or is there a community exposure, high level of community exposure that would provide objective evidence that the person provided that was a direct threat to themselves and other coworkers. If that could not be objectively established, probably through the local officials out there, then to try to quarantine them or isolate them would be overreaching and could be a problem for a company. Going to the first point, and that is employees who nonetheless are unwilling, have concerns about working side by side with that individual because they are seeking to come back into the workplace. That is going to be a responsibility of management to really educate, assure, and focus on the proactive measures that you are providing the employee population as a whole, that those concerns that they have really aren't founded based on the objective information that's out there regarding traveling to that type of a locale, number one. And number two, what you are doing in the workplace to reduce the concerns about exposure across the board with your company.
So this is combining two questions because it's about pay. So if somebody is quarantined by a medical professional, do we have to pay their wages? And also, if an employee wants to come in, but we don't think they should because they're not feeling well, can we recommend that they stay home, and do we have to pay them?
Okay, the answer to the first question is no. Just because the quarantine is being driven by medical professionals, there isn't an obligation to pay someone during the quarantine. Certainly if they're a non-exempt individual, if they're not working, there's not an obligation to pay. Whether they might get compensated through the use of available paid time off that you might be willing to provide is another matter, but there wouldn't be a per se obligation to compensate them. And for the salaried exempts, again, If the quarantine is such that they are not working any part of the week at all, then no, there isn't an obligation to pay them either. What was the other part of that question, John?
That if they wanted to come in, but
Oh, if in fact you had someone who was sick, who was trying to come back to work, but they were coughing and had fever or sneezing, and the question is, we don't want them in the workplace because we don't want them coughing all over our coworkers. We don't want them coughing on our guests, our customers, or clients that might be on our property, or what have you. There is an ability then, you should be somewhat consistent in your approach with these type of circumstances, but you do have the wherewithal to say, look, we don't want you in the workplace. You're not fit to work based upon the objective observations we see in terms of you coughing and sneezing, and we do want you to stay home. Now, again, do you put into place initiatives economically that set up in a relationship where they truly aren't coming back until they're feeling better is another matter, as far as maybe it is remote work arrangements or loosening up on how paid time off is used.
So if an employee loses their child care due to school closing or daycare closing, how can an employer be proactive to help accommodate that?
Well, I mean, that's going to be a growing difficult question to challenge or to contend with. Certainly, when it comes to daycare challenges, and the economics of supporting daycare, if someone isn't working due to not being able to work because they're sick or not being able to work because they're quarantined, there might very well be bills to pay for supporting daycare needs. To the best of my knowledge, there's no programs out there that would otherwise augment financial resources through states right now to accommodate those individuals. Whether companies wanted to provide, additional PTO or compensation to support those needs is another matter. But again, that's going to be a question of cost and support. And I think you got to be careful with that because, again, how your workplace might get hit when it comes to this in the workplace is a whole entire different question. Can you afford to do that with one or two people? Maybe so. But what if you get exposures that flourish in the workplace and you get more and more people where you run into that similar plight? Can you afford to scale and take on that additional financial burden with several or dozens of people who end up going out that way? Is that something that you can afford to take on in your budget? So I would just be very careful in looking at your financial resources. And I think you need to look at that also in context with, again, type of workforce and age demographics you're talking about to really gauge what do you think might be the likelihood of exposure, how long might they be out, and then how much are you willing to put on the table across the board for people who are in that similar situation. Because if you start doing it for some people but not others in a similar group, that could create some employee relations fallout for you. So I think the question of looking at that very carefully so you can be consistent in your approach is advisable.
So if an employee shows up to work with flu-like symptoms, are we okay to tell them to go home and force them to use their available time off?
If they're showing flu-like symptoms and are therefore not fit to work, then yes, sending them home and having them use their PTO can be an option.
If we do temporary layoffs, do we have to pay accrued time off?
That depends on whether or not they're still employees of yours or not. And again, I say it that way because people use the term layoff very loosely. If the layoff is such where they are actually being separated from employment and taken off the payroll, then paying out earned but unused and remaining paid time off might be a requirement under state law. If, on the other hand, you're simply furloughing them where they're not on the work schedule, but they're still an employee of yours. They're still on your role. They're on your payroll. They're on your rolls, but they're just not working hours and drawing a paycheck. Then there wouldn't be an obligation to pay out that time.
And if somebody does self-quarantine and has the ability to work from home, are we allowed to let them work?
Yes.
Okay.
I mean, that's something which, as long as both sides are willing to do that and you're not compelling them to work from home against their will, then that would be okay. Certainly, on the other hand, if they had the technological means to work from home, but they still were suffering from this with the condition, then you could be stepping on their toes under state sick leave laws or even under the Family and Medical Leave Act if it's a company over 50 employees, because people have the right to stay out on leave if they have a serious health condition, and in all likelihood, this would be deemed a serious health condition. On the other hand, if they are asymptomatic, okay, and they have the means to work from home, you might have more ability of holding them accountable there, which, again, that might be something that may be less of an issue because they might be economically motivated to work nonetheless.
So again, I know you've touched on this already, but a couple more questions about if an employee returns from a trip to Portugal or they go to California, can we ask them to self-quarantine?
Okay. I'll take them in reverse order. I'll be honest off the top of my if Portugal is on that list of 26 countries, and I don't remember off the top of my head, it very well might. If they are on that ban list, then you could require someone to self-quarantine. If they're not, then self-quarantine would not be an option. On the question of California, you couldn't require self-quarantine just for going to California. Quarantining would only be an option then is if there was objective information to know that they in fact had an exposure while they were out there. Simply traveling to California in and of itself would not be enough to establish that.
So if we as an employer tell somebody to stay home because they are sick, can we, one, enforce our attendance policy if they are out of PTO? And number two, if we decide to give them excused time off, if they don't have the time, can we specify that it is only for folks with the symptoms mentioned here and bring documentation from a physician?
As far as holding them accountable for attendance above and beyond the available PTO, if they remain sick, I think I would be a little careful there, because if they are being evaluated still for exposure for COVID-19, and depending on its severity, it could rise to a level of a disability on its actual basis then. And because like I said before, people who manifest the conditions of COVID-19, it could be a mild or it could be a severe case or something in between. Depending on its severity could determine whether or not it is in fact a disability if it's symptomatic. If it rises to a level of disability, then of course there is this duty to reasonably accommodate under the Americans with Disabilities Act. Maybe some additional temporary time off without repercussions could be a form of reasonable accommodation depending upon what might be needed. And a lot of times, a lot of your state agencies would have that expectation. Therefore, because you may not know where that condition is going or evolving, starting down the immediate path of counting them as attendance is probably not advised, probably not going to be a good move in fostering employee relations, and it might trigger people trying to come back to work sooner than when they should, which could exacerbate exposures in the workplace.
So we just had a question about would the audio be available, and we do archive our webinars. It should be archived on our website probably late this afternoon, if not by Monday morning. Okay, so we're in a service industry. We have hourly employees whose job is done primarily by phone and on a computer. If we shut down our office, are we allowed to have our hourly employees work from home on their own personal computers or phones?
Yes, that's an option. Certainly you'd have to pay them. Certainly there creates some challenges and responsibilities for you to think about in going down those paths. I mean, making sure you can keep track of when they work, how they work. Are you in fact paying them the wages for all hours that they work for you? Are some of the things from a wage and hour perspective to be mindful of. But the other thing is really more from a technological and systems perspective, not knowing what in fact they are working on, since the question was a little silent on that. You know, I think the question is, what type of information are they accessing? Is it highly sensitive financial information? Is it personal information? Is it health information that might be otherwise protected by state or federal data privacy standards? If that's the case, then the question's going to be, well, what type of protections, antivirus software, malware systems are in place to protect against potential breaches that might cause exposure of that information? That might be a question. And then the other piece is going to be, how are you going to allow for the access so that information isn't, for instance, taken and held on their own personal machines in manners that might create unauthorized disseminations of information elsewhere? So all I can say is it's possible, but there are other considerations you really need to be thinking about and planning about before you go down that path. And maybe that does mean providing some tablet or laptop of your own, if that might be easier to do than jumping through all of those hoops.
So if an employee has a doctor's note saying that they're cleared to return to work, but they still have cold symptoms, can we ask them to stay home?
I think the more prudent course of action there might be to get a second or third opinion if, in fact, the objective information would seem to cast doubt over the legitimacy of the fitness for duty.
So if someone reports a 101 fever and calls out of work, do we make them self-quarantine?
That's a real good question, because the question then becomes whether or not you've got enough additional information to show it's more than just the cold and flu. I will say, because we're now dealing with a pandemic, that it opens the door for more inquiry and dialogue of the individual as to who they might have been exposed to. Do they have any other knowledge that might give rise to knowing whether or not they, in fact, might have something more than the seasonal flu? So I wouldn't say it automatically goes down the quarantine path yet, but it does open up doors to do some additional probing and investigating, including having the person maybe check their healthcare provider and maybe get a fitness for duty thereafter. Maybe that is the alternative path, as opposed to doing the automatic 14-day quarantine. It might be that you're doing something along the lines of, look, you're not fit currently to work, but so we're going to need you to go check out with your healthcare provider, and until they green light you to come back to work through a fitness for duty, we're not going to have you work in the workplace. So it may not be the same as an automatic quarantine, but it might have similar outcomes for you.
So as a follow-up to that, if we do ask for a second opinion, do we have to pay for the doctor's bill for that?
Generally, the answer to that question will be yes, especially if you're an FMLA-covered employer. The Family and Medical Leave Act does put it on you to subsidize those things. I think, to me, if you're not covered under FMLA, it's more of an open question. Under wage and hour law, usually you're only on the hook to compensate if you're not only driving, if you're really driving who they specifically see and when they specifically see them, that could lead to that outcome. But if they really have the freedom, then if you're not an FMLA covered employer, then that is more of an open question on that. I think the real answer, though, becomes, do you really want to put that on their back when you're really trying to get objective information timely to know how to properly act? I would recommend you might want to go down the path of absorbing that cost if they already absorbed the initial cost.
So the last question we have, and it's come up a little bit, talking about retail or even thinking about, restaurant workers, what are the expectations if my employee doesn't feel comfortable working with the general public?
Well, the question is going to be, do you have the wherewithal of holding them accountable to doing their job or not? And that's going to be a byproduct of the information that's out there regarding potential levels of exposure, where that workplace or restaurant might be. Certain communities have more of an exposure risk than others. So, to that end, unless really deemed otherwise by state and health officials, and unless there's other objective information that would really show that there's an exposure in the workplace, an employee who's just basing it on stereotypes, assumptions, and their own perspective without any additional incident really isn't going to have the ground to justify refusing to work without consequences if a company wanted to hold them accountable. I think the real question then becomes, do you really want to go down the adversarial path of taking action, or do you just take them off the schedule and try to work someone else into the mix who might be more willing to take on those shifts?
So, Mark, this will be the last question we have. So with knowing that the healthcare industry is very busy right now, and somebody's trying to get clearance to come back to work, but they might not be able to get it in a timely fashion, can we let them back to work without that clearance?
Well, I think if you can just repeat the first part of that question.
So keeping in mind that the healthcare industry is very busy, and an employee may not have easy access or to get clearance in a timely fashion, can we let them back to work without that clearance?
I guess, what's silent in the question is whether this person is coming back to work, but they were asymptomatic, or if they're coming back to work and they actually were symptomatic and unfit. Certainly, if they were asymptomatic, you could bring them back, of course. If they were manifesting symptoms, but they just didn't get the formal return to work, I think it becomes a judgment call on your part as to whether or not you're comfortable with them coming back to work without that documentation or not, based upon, the symptoms or lack thereof that they are experiencing and manifesting. And that then is going to become a judgment call on your part.
Mark, you've been excellent answering all these questions, and I know for a fact that I've learned a lot. I'll turn it over to you to close us out.
Well, John, thank you very much. I know we went over our time. I think hopefully that was for some additional value for those that did stay on the line today, and we hope, like to John's point, we answer your questions. Again, we will be making this recording available and making our feedback available. Thank you very much for taking part in today's program. And again, this isn't the end. It is just the beginning. So please continue to tap into those resources, tap into our team, tap into what we provide. We're here for you, and it is something that will continue to unfold. But thank you very much, and enjoy the rest of your afternoon. Take care. Bye.